we've decided which size calf wrap liner to utilize, we're gonna go ahead and don it onto our patient. For this particular technique, we're gonna have the patient stay seated for the entire time. What we're gonna do first with our fresh calf wrap liner is just stretch it out a little bit and sort of make sure it's opened up. Sometimes it can stick to itself and get pretty tight, especially fresh new ones. So we're gonna wanna stretch it out a little bit. Next up, we're gonna wanna roll it so that we see a decent amount of this light gray color, okay? We wanna get it such that we can really grab onto that light gray, smooth material on the inside and use that primarily as what we're using to get that liner on. If the white urethane part comes into contact with the patient really at all, it's just gonna make it difficult for us to slide the liner, all right? So I'm gonna come up nice and close, holding on to that gray part. I'm gonna slip it over my patient's toes and then over the back of their heel. And take your time to make sure that you still have that gray part with you. Okay, a lot of times during that piece over the heel, it can get sort of all balled up, and the next thing you're grabbing onto the white part, the sticky part. I'm gonna bring my knees over top of this patient's foot so that I can get some stability through it as I work my way up. I'm gonna put either my thumbs or my fingers all the way down in there, and they're gonna stay in there the whole time. So I'm gonna pull it away from the patient and up a bit, bring my fingers forward, and just work my way up and up and up, and just taking my time. There's no rush to it. Okay, and once I get to a point where visually it seems as though there's about this much space left to get to the patient's level of their popliteal fossa, that's when I'm gonna stop pulling up and then turn to flipping. So we'll come up a little bit more here in this case. When patients are seated, it's gonna look like it's higher than it really is when they end up standing. So we really, when they're seated, wanna get it nice and high up into that knee crease. From here, I'm gonna get my fingers under, and I really wanna make sure I do a good job of coming away from the patient and placing it onto him. Away and placing it onto him. Okay, if I sort of just let it roll and fold up, again, we're gonna catch the skin and the hairs. Okay, so we're gonna come out, right up on the skin, out, right up on the skin. Okay, so it looks a little wrinkly in the back right now, but as we mentioned, because we're seated, that's gonna end up being okay when he stands up. That's gonna smooth out right away. The bottom part is fine. You can just sort of grab and smooth out the bottom. That's the slippery part there. If you decide you don't like where you're at, you need to move it up or down. We're gonna need to remove that sticky piece and either adjust it all the way up or down. You may be able to get your fingers in there to do that. If you're unable to get your fingers in there with hairs and things, you can use a piece of Velcro and stick it to that top part to pull it away and create some room so that you can get your fingers in without, again, sort of clipping those hairs. So from here, I would pull it out and down. I'd come around to the back, out, get that light gray showing, and down. Okay, from this position, now I can easily get in there and readjust up, readjust down, or all the way down if we're taking it off.